Hello, my name is Jenny Kim. I'm a geriatric nurse practitioner at Vanderbilt. And today I'm going to be talking about long COVID syndrome, both the physiology of it as well as clinical management. This is part of our Mid-South Project ECHO education series. Here are some learning objectives that we have for you. By the end of this session, we hope that you are able to name at least 2 common symptoms of long COVID, as well as 2 ways to support somebody who has long COVID. And then finally, our objective for you is that you understand that the COVID-19 vaccine reduces the risk of long COVID syndrome. So the first question you might be thinking now is, what exactly is long COVID syndrome? This is something that is very poorly understood, but there's more and more research coming out each day that is really helping us understand what it is and how to treat it. By definition, people who have long COVID syndrome, they've had these COVID symptoms that developed during their initial infection, and these symptoms will last for 2 or more months. We also know that people who have long COVID syndrome, their initial COVID infection really differed in terms of its severity. Some people with long COVID syndrome were hospitalized, where others really had not a very severe illness course. And then finally, long COVID syndrome is now being considered a disability underneath the American Disabilities Act. Long COVID syndrome has many different names. You can see here, you may have heard it called post-COVID, long-haul COVID, post-acute COVID, as well as chronic COVID. Right now in the medical community, we are referring to it as long COVID syndrome. So how common is long COVID syndrome? Here's the thing that we know right now. More than 50% of all people who have COVID infections are going to experience long COVID syndrome. The next question you might be thinking, what are all the symptoms of long COVID syndrome? Listed up here on the screen are all the potential symptoms of long COVID syndrome. And there's a lot of symptoms here, and this is not a comprehensive list. Other people may have experienced other long COVID symptoms, but you can see there's an asterisk next to the 3 most common symptoms that people with long COVID syndrome have. There's that difficulty with breathing or shortness of breath. Oftentimes, people with long COVID syndrome need supplemental oxygen because of this difficulty breathing. There's also that fatigue. So many people with long COVID really experience profound fatigue, and it's fatigue that really they had never experienced prior to their COVID infection. And then there's also the issue of a difficulty thinking, difficulty concentrating, something that we call brain fog. Many people with COVID-19 or long COVID-19 really complain about this inability to be able to do well at work or inability to be able to operate like they did prior to their COVID-19 infection. And as I said, all these other symptoms that are listed here on the screen, they're also common symptoms, but really the 3 most common are the things that I've just talked about. How long do these symptoms last? Which is a really good question. So we know that when we're looking at long COVID symptom and looking at how long these symptoms last, there is quite a bit of variability. We do know that if you have type 2 diabetes, that this really puts you at an increased risk of having not only long COVID syndrome, but actually having a longer symptom duration, as well as any kind of pre-existing medical problem. It also typically will depend on the severity of the initial COVID infection. Also, the duration of symptoms also could very much depend on the number of symptoms that somebody had during that initial COVID infection. So if they had more COVID symptoms, it's likely that these symptoms are really going to be much longer in their duration. Next question you might be thinking is, what kind of treatments are available for long COVID? The important thing to remember is that there really is no cure for long COVID, which is something that can be very frustrating for people. But we do know that there are things that we can do to help support people while they're experiencing this long COVID syndrome. So we can provide supportive care. And typically this means providing assistance with ADLs, providing assistance with ambulation. You'll also see that people have to have supplemental oxygen until their oxygen saturation is at an acceptable level. There is a risk for rehospitalization when people have experienced or are experiencing long COVID syndrome. But the important thing for you, if you're taking care of older adults in a long-term care facility who have long COVID syndrome, it's really important to understand and to remember that they might need more time to complete tasks. They might get fatigued much more quickly, and they also might need oxygen much more frequently than they did previously. And sometimes they might even need oxygen when they didn't need it before. When you have long COVID syndrome, you really do need to be evaluated by a healthcare provider. If you have been hospitalized, it's important that you see your primary care provider 1 to 3 weeks after you've been discharged from the hospital. And you think about those patients that you're taking care of right now in skilled nursing facilities, they need to see their primary care provider 1 to 3 weeks after being discharged from the skilled nursing facility. There are also things that we have now, COVID-19 recovery clinics that are all across the United States. If somebody is experiencing symptoms beyond 12 weeks of that initial COVID diagnosis, really need to consider going to a COVID-19 recovery clinic. And these are clinics where the complete focus is on COVID-19, and that's what these physicians specialize in. And the evaluation is really going to vary, and it will really depend on the type of symptoms that somebody is having. It's very likely that if somebody has long COVID-19, they're likely going to need physical therapy or occupational therapy, maybe even speech therapy. And it's also important to remember that prior to engaging in these therapies, oftentimes these patients have to undergo some kind of cardiac screening before they do any of these therapies. As I talked about a couple slides ago, there are post-COVID care clinics across the United States. And you can see up here on the screen, this is a screenshot from survivorcore.com. And it's an interactive map that as a user, you can hover over each state, click on that state and see what is available to you in terms of a post-COVID clinic care within your area. And as of right now, the 2 states, North and South Dakota, do not have any type of post-COVID care clinic. However, things are moving so quickly, hopefully that will change. In our great state of Tennessee, we actually have post-COVID care clinics in all the major areas in middle as well as East and West Tennessee. How can you prevent getting long COVID? Vaccination. We know that vaccination really does reduce your risk of having long COVID. And there's also some testimony now that patients that were never vaccinated, that got COVID and are now experiencing long COVID syndrome, that with vaccination, we are starting to see some mitigation of those symptoms that they're experiencing in long COVID. So COVID vaccinations are just very, very beneficial. That same website that had the interactive map, if you go to the main page there, survivorcore.com, you can see it has such comprehensive resources there about where to get even COVID tested, as well as things that you can do to take care of yourself after a COVID infection. And there are also materials there and educational resources that are printed in Spanish as well. Thank you so much for tuning in. And we have enjoyed having this session for you. I hope that you've learned a lot.